Good morning, and I want to welcome Dr. Deep Kanth today with me. He is a proud Damsonian and he secured rank 82 in May PGI 2017 postgraduate entrance exams. Heartiest congratulations, Deep. So how do you feel today?
Kind of good, ma'am. Actually happy. It's been a very long time.
Yes. So he says it's been a long time. Yes, Deep has done a lot of hard work. I have seen him myself. He's been a student with us. He joined regular course and then he's also done a TND with us. And I've actually seen the amount of hard work he puts in, even when he's sitting in the classes, right? So let's start with that only, Deep. Now, how important do you think is it to be there in the class and be a member of the class when it is happening?
That is like foremost important, ma'am, because that's the primary thing where you can clear everything, understand your concepts there itself. You cannot get concepts by reading someone else's notes.
That's
you cannot get concepts by reading someone else's
conceptual knowledge for these kind of entrance exams.
That is crucial, ma'am, very crucial.
Because the pattern has changed. Exactly.
They are asking highly conceptual things. For example, they asked a question on brain and they pointed out in the midbrain and asked what is the disorder.
Exactly.
People did not even identify that it is midbrain.
Yes.
You cannot learn those things by yourself unless you sit in the class and understand, okay, this looks on cross section, this looks this way, that way.
Yeah. And since I know you, I've seen you attending classes. Tell me, when you attend a class, what is the idea when you're sitting there? Because there are a lot of students who are doing regular with us and they would want to know from toppers like you that when you are sitting in the class, what should be the mindset of the student when he's attending the class?
Try to finish that day's work that day itself.
Okay.
Try to revise at least whatever is done that day in the class.
Okay.
At least 50% or 70% of it that day when you go back to the room.
Right.
Don't enjoy life after you go back to the room after that day's class.
So I do believe that first, for at least 6 months you need to give a dedicated time to your study. Right.
Don't think you can do all the classes whatever you have written after the course.
Yes.
That's the biggest blunder, ma'am.
Okay.
You try to do it side by side.
Try and be punctual and try and do things the way they are done in the class, because I think one is that they are fresh in your mind, the concepts get stronger, and also you get to know what things you want to ask the teacher in the next class.
That is very important because you'll know what doubts to ask in the next class.
Yes.
You'll be prepared for the next topic. We read this topic, no, next topic is going to be this. Okay. You'll have an idea preset. Like suppose you learn the anatomy of gynec, pelvis and all these things, you will understand in hysterectomy what all structures are removed.
Exactly.
Directly you come for hysterectomy, what all structures are removed, you won't understand.
It's just a mugging up thing and then you forget it as well. He's very right. So once you make your concepts clear, I think the mugging up part goes down. Right? And the moment you keep doing that, you will understand that medical science also has, yes, there are parts which need to be mugged up, but there are equal or even more parts that are more conceptual and they help you in retaining things which you have sort of just remembered.
Yes,
that's great. Okay. And how important is practicing questions, Deep?
Ma'am, without practicing questions, it is very difficult, ma'am, these days, frankly, because you need to know how the questions are asked. How much ever you read, you will not be able to apply them if you don't practice.
Right. So yes, he's right. To learn whether you can apply what you've read or not, you should practice questions.
Because they twist and ask, ma'am, nowadays. Because you should know how they are twisting also these days.
Exactly.
You will get prepared at least, and on the day of exam when you see the question, I know they are twisted this, and you can answer them directly, ma'am.
That's right.
That is important.
And since we're talking about questions, can you tell us, was the test and discussion course helpful for you? Does it mimic the exam, and are we able to maintain the quality of the paper?
Yes, ma'am, definitely, because certain test and discussion, like for example pathology was brilliant, ma'am.
Okay.
Exactly, they gave nice chunk of questions which are large clinical based, and also good images.
Yes.
The same immunofluorescence like images were there.
Right.
And that was really helpful, ma'am. Really helpful.
Wonderful. Have you given the grand tests also with us?
Yes, ma'am, I have given the grand tests.
And do you think they are beneficial?
Much beneficial, ma'am, because you'll know where you stand.
Right.
You
Very
should
important.
know.
Each one of us should know because it is a competitive exam. So we need to know what exactly is our stand as of now and how much do we need to buck up, right?
You need to know how much you have to improve. There's always a scope of improvement, ma'am.
That's right.
Always.
Okay.
You have to believe in that always, that you can improve better.
Right.
Otherwise it won't work out.
And Deep, I'm sure because you've been a regular and a TND student, a lot of them would also want to know how do you plan your revision strategy?
Ma'am, I have to take thanks to first Dr. Ravi Sharma of November 2014. Even though I never met him, I've only seen his interview.
So that is how the interviews are important, right? Each interview helps to know, at least to buck up some of these students there, and tell them that they can do it as well.
He told a very nice strategy, ma'am. He said that you have to do a funnel effect. He said that you have to first finish in the first 4 months. That is what I exactly did. I finished it by March. I finished my this thing. April 1 month time was there. Then in whatever you did in 4 months, try to do in 3 weeks. I did that in 3 weeks. I revised properly in 3 weeks. At the same time, gave tests also.
Okay.
Then the last 10 days was left. In the last 10 days, in the first 1 week, try to do all the latest updates if you can, because you're not supposed to break your head in the last 3 days.
Right, that's right.
So first 1 week, try to do like PSM updates, whatever updates you can get.
And these days they are asking.
They are asking because one question was there on tuberculosis, ma'am. What is the next line of investigation after that?
And
it has recently been updated.
Yes.
So you have to do in the last 1 week. Then last 3 days, just turn the pages, ma'am. He told this very nicely, ma'am. When you're reading something,
so don't do anything new in the last 3 days.
Just turn your old notes, first line, mid line, last line, turn the page, because that page should strike in the exam.
And it's very important that those notes are your own, because you know exactly how to pick them up in last few days quickly and what to revise from them.
And most important, ma'am, you should be cool, ma'am.
So he has something very important to tell each of you there, that how important are the 3 hours of those exams?
Because whatever you have done 3 weeks and 3 days, those 3 days, whatever you have done, it should be finally on the 3 hours of exam, ma'am.
Exactly.
So you should be so cool. I've lost my aims because of that only, ma'am, because I was not cool. The first 100 questions I gave relaxed. After the next 100 questions, I did not have time. I started putting more and more questions for review.
Right. And then
I lost all the questions. I couldn't again come back to them, ma'am.
That's right, because the paper was a little lengthy as well.
It was lengthy. It was not a difficult, it was lengthy. Confusing, lengthy, but not impossible. That's what I felt, ma'am.
Right. So very important, I think, piece of advice for every PG aspirant, that the 3 hours of the exam are very, very crucial. So you should be in a positive frame of mind. Think that you're there to do it, and you've been doing it, and it's just another test that you're giving. Give it with a very cool mind, and you will achieve, probably more than you expect as well, right?
Okay. And for PGI also, it was good, ma'am. PGI actually, it's a time consuming exam, but this time I don't think it was time consuming, ma'am. Everybody finished before time. It was reverse, ma'am. AIMS took more time than PGI this time.
Okay.
That was a wonderful thing actually.
Yeah.
And that is why I got through PGI somewhat.
No, but you've achieved a great rank. Rank 82, a double-digit rank, is not easy to attain in central institutes, and you totally deserve the credits for your hard work, your dedication and persistence. I think I've seen him through, and the one word I would like to describe Deep is be persistent. He's been a very strong worker.
Thank you,
he's maintained his balance, and he's been working hard, which everybody works hard, but you need to be persistent, right, Deep? And never quit.
Give up.
Never give up. That's wonderful.
There are days, ma'am, you'll go mood out, mood in, mood out. That's there, ma'am. Everybody experiences it, ma'am.
That's true.
Always come back harder next time. That's the only thing. You may lose 1-2 days, ma'am. No doubt in that. But come back again. Hit harder.
That's the only thing, ma'am. So you have to keep coming back and keep coming back with even more zeal, and that's what he says, hit even harder next time. That's great, and we would like to wish you that for your next aims, and I'm sure that you're going to do very, very well, and we're going to sit again and do an interview with you to help your juniors again. They would get inspired. Okay, Deep, how important is the Facebook club? You were a part of the club. Do you think it is useful?
It is useful, ma'am. I didn't see what the students posted, frankly.
Yeah.
I only used to see the teachers' updates.
Wonderful.
Because that was very crucial.
Yes.
Frankly, ma'am, I didn't see the students. The teachers' updates were very important. Like I already told you, ma'am, the guidelines of PSM updates, gynec updates, all these I have seen, ma'am. Medicine updates, the protocols especially, ma'am. Those things I kept on tracking, ma'am.
Wonderful. And were you able to solve your queries as well through the club?
Yes, ma'am. Few.
Okay, great.
Honestly.
And did you attend the visual session as well, Deep?
Yes, ma'am, I did attend.
And was it beneficial? What do you have to say on that?
The best part of the visual session was, it made me understand that I can revise a subject in 3 to 4 hours.
Just by looking at the
images.
Absolutely, that's what I say.
If you look at images, your revision time decreases by half, ma'am.
Right.
That is a important thing.
And you also get to know what are the hard-hitting
topics.
And you can keep revising them more often. Just keep looking at the visuals and then go back to some of the theory of it. And because, the same things are important. They might be asked as a visual, they might be asked as a one-liner, they might be asked as a clinical question. right? So yes, he's given you a very key point. If you want to revise subjects in a shorter span and you want to do it efficiently and do topics which are important, the visual, the DVD sessions are very good. Just pick up the slides and go through the slides, go through the theory of it, and you know, you tend to revise.
You tend to revise faster, ma'am. Nothing else.
Great. So Deep, any message that you want to give for your juniors out there?
Just don't give up, nothing else. And I would like to thank certain people, ma'am. Like,
sure, please go ahead.
I would like to thank first of all, my parents, no doubt.
Definitely.
And my elder brother. They always gave me the comfort which I always wanted.
The family support is very important.
The entire batch of 2K9 and 2K11 of Kamneni Institute of Medical Science.
Great.
And certain people over here which have really helped me over here in DAMS classes. To name a few, like Mansha, Shweta, and most important, Hazel Talwar, Avinash Bansal. They have really, and Aman, they have really helped me a lot, man. These people.
So you formed some good friends at DAMS,
They helped me a lot, man.
And they're going to be friends forever, I'm sure. No matter you're competing for the same exams, but you know, the friendship remains. That's wonderful. So all of us here at DAMS, the faculty.
For the juniors, last thing is like, just learn how to concise things here. You should know how to funnel down to, so that, because everybody goes mad 1 week before the exam. No doubt in that.
Right.
Person who knows how to revise properly.
Yes.
You know, you should know. Any strategy is a good strategy, but provided you follow it. Everybody makes strategy, ma'am. No, hardly many don't follow it, ma'am. Their own strategy they don't follow. That's the only thing.
Saying make your own plan, make your strategy, but even more important is sticking to it.
Sticking to it, ma'am. Sticking to it. Nothing else, ma'am.
Right. I'm sure your advice, your inputs are going to help a lot of other people as well. Right, just like you got inspired by someone.
I got inspired by him. I never met him also.
Right, so the others might get inspired by you, which is the sole purpose of conducting these interviews, and they're conducted live so that they know that it's all on the spot. It's whatever the student wants to say, and it's from the bottom of the heart. So from the DAMS faculty, from your colleagues, from everywhere here, we wish you a very bright future ahead. We wish you all the very best, and we already see a great doctor in you. Thank you so much for being here, Deep.
Thank you so much, ma'am. Thank you. Thank you.